do whatever you need to do to contact me, and I will talk to you.
But there's always things out there. There's free phone numbers, isn't there? There's, you've got the NHS 101, you've got crisis teams. They're all free phone numbers.
So all this info that we've got that we can give to others, we can put in the description.
Yeah, you've got Samaritans, you've got Saneline, you've got Mind.
So when I do the description for this video, I'm going to need to help me with that because I don't know all that stuff.
But yeah, there's hundreds of organisations out there, and there's lots of places where you can just go.
Like what?
Well, I can talk about some of the ones locally, but they're everywhere, and I think there's lots of hubs that have and wellbeing cafes and stuff. There's even like Lincoln City have got like a men's group now, haven't they, on a certain night of the week? I don't know which night it is, but where you can just turn up.
Okay, so what you're saying is they're not like... So I know that when I was struggling, I went to my GP. You're talking about like public groups.
There are, yeah. I mean, obviously, my advice would always be to go to your GP. Would be your first point of call if you're struggling, you need treatment. But in terms of building, because when your mental health breaks down, it doesn't break down. You're not okay one day and then the next day you're like poorly. It's a gradual process. So I guess the first step's getting help, but then it's about rebuilding your mental health, much as you would do your physical health. You would go through a state of recovery or you wouldn't just wake up better physically, would you? If you've got, a broken leg, you'd have to allow it to heal, and you have to do physio and have treatment, painkillers, or whatever the treatment would be. So yeah, your mental health's the same. So rebuilding, but there's lots of groups and lots of things. And I say groups, people think, oh my God, I don't want to go to a group and sit there and talk about, my name's Mel and I've been struggling with mental health. But often they don't even talk about mental health. It's just a space where people can go. There's stuff for women as well, stitch and bitch groups, knit and natter, whatever, morning coffee.
Stitch and bitch. Can men go to them as well?
Absolutely, no, and libraries and there's all sorts of.
To just get out there.
Just get out. Don't sit in the house. Don't sit wallowing in your own thoughts, because they just get bigger. That makes sense.
Yeah. No, it makes. I'm just gonna take my slippers off
and the more a little bit. And the more you say to yourself, right, I really mustn't try and think about I mustn't think about my mental health. Got to think about something else. The more people focus on it, because it's like, I don't know, if I said to you, don't think of a red ball, and like an image of a red ball would probably pop into your head. And then if
I thought about a Red Bull, I thought you said Red Bull.
But then if I keep saying to you all the time, like, oh, you're making a cup of tea, don't think of that red ball. Okay, I won't think of that red ball. And you're cooking something to eat, going to the toilet, having a bath, don't think of that red ball, don't think of that red ball. All you start thinking about is that red ball all the time, and your problems are the same. So sometimes it's just about doing something else, and finding what works for you, because what works for one person doesn't work for somebody else. If I stuck you in a room full of women that were knitting and nattering, and
I can't knit,
you'd be probably really overwhelmed and have a sense of wanting to run away and escape.
If you stuck me in a room full of anyone.
But if I put you in a gym and said, right, you need to go in there and have half an hour, put your headphones in, listen to some music, slam out some weights, that'd probably be really positive for you. So that, I suppose the role of a mental health nurse, if somebody gets to the point where they need a mental health nurse involved, because most people with mental health problems never access mental health services. They access mainstream services or voluntary services, or just stuff that's going on in the community. So you've got to be pretty poorly to be accessing my kind of service, I guess. But so
what's it like then, working on a mental health ward? Is it like, it's not going to fucking Tesco's and putting beans on a shelf, is it? No offense to people that are shelf stacking, but it's not a regular Monday to Friday 9 to 5. Like, I imagine, I've worked in some pretty rare environments myself. Is it like one of them things where you just got to be there to believe it? Like, you walk in and Like fucking Fred standing on his head in the corner singing the national anthem. Like you see, like when you see it on telly, it's like fucking padded rooms and fucking people rocking.
But that's
and,
where the stigma comes from, isn't it? That's what people think mental health wards
yeah,
look
yeah.
like. So
What is it like?
just work with people. They're just people.
And they're just everyday people wandering around.
Well, I wouldn't say they even wander. Sometimes they watch telly, and sometimes they cook a meal, and sometimes they go for a walk, and they go out to the shops. And like, I suppose I work within recovery services, so it's about rebuilding their lives and function and leisure and social, and every aspect of our lives that we take for granted. Somebody with severe mental health problems might have lost all of that, so they might need assistance in every aspect to rebuild that. And that's what we, me and my team do.
And then society makes it harder for them.
Well, it does when you think that they're just like, if everyone that lives across the road from where I work, if all those people there think that everybody in there has just stood on their head singing the national anthem, that doesn't stand my folks in good. It doesn't do them any favours, does it, when they want to go out to the shop and then they meet those people, because those people are going to be like, or a bit wary or a bit worried or concerned that. But
And do you find that's the case? Do you find that's the case when you're out and about? Because you can visibly see it at times, can't you?
sometimes you can, yeah. Sometimes you can.
And do you think we do enough as in society
I think
break them barriers down?
I think society's better. I think it's better than it's ever been. But there's always work to be done. Always.
Because I know what it's like. I've worked on their wards. I'm just trying to.
And I'd advocate for my patients every day of the week. And if anyone gave them a hard time, they'd have to get through me, because I wouldn't stand for it.
And that's why you do what you do, because you're that kind of person. And I ain't got to say this because you're my wife, but that's how you can do the job you do, because you do genuinely care, because you are compassionate, you do have sympathy, you do give a shit about other people. Because if you didn't, you couldn't do your job, could you?
No. And I suppose like I say, I work with people, and you get arseholes with mental health problems, and you get good people with mental health problems. You get all walks of life with mental health problems or illnesses or concerns or whatever the label is that you want to call it. But yeah, I think if you treat people with respect and you treat people with dignity and you have a genuine compassion and you want to help and improve or help people to improve their own lives, then you're in good standing to be a fairly decent mental health professional.
You're a good person.
I guess so.
Do you enjoy it?
What, my job?
Mm.
Yeah, I do actually. I've done it for 23 years. And we don't do it for the pay packet.
Let's not start talking about pay.
No. But yeah, but then when you look at people's hierarchy of needs in terms of job satisfaction, pay comes down about ninth. Ninth on the list of what's important to people in terms of why they do the jobs they do. That most people don't do it for the pay.
No. Which, I mean, I suppose this day and age, does anyone do anything for the pay? I certainly don't do my job for the pay.
I could do other jobs that paid the same with less politics and less stress.
Oh, now you've mentioned politics.
Not doing politics.
Okay. So if you was a millionaire, right, didn't have to work, would you still do your job?
I wouldn't do the job I do now, but I'd still work with people with mental health problems. But I would do it in a different way.
What, like privately, or
What, in a cupboard?
would you just find a different? Yeah. Would you just find a different way to help people with mental health issues?
What would I do?
Because we know that and I know you've got to be careful what you say because you're employed by the NHS and, you've got to be careful what you say. But we know that across every standard of large organisations, there's things that are wrong that we think that could be done better or done different. Prison service was the same. Working with young people is the same. I would imagine
it's the greatest good for the greatest number, isn't it, within the
Yeah.
NHS? So,
and it does a fantastic job. And I don't want you to think that I don't think that. You know how highly I hold what you do and what all nurses do on the shop floor. I think when it starts getting up to senior manager level, I don't really know enough about it. I don't want to get into politics because you don't want to talk about politics. But nurses on the shop floor, I do think, are underpaid and overworked. And I think it must be an absolutely thankless task. I can't imagine working in an A&E department on practically minimum wage. Because I was reading something yesterday, or it might have been something else, that was saying that you can hit McDonald's are paying more now than
for a band 3 healthcare support worker.
So what? Yeah, that's not a nurse though, is it?
No, it's a nursing assistant, or it's somebody. It's a healthcare professional that hasn't got a qualification or a nursing qualification from the NMC. So,
But they do all the shit.
Oh yeah,
they do all the shit jobs,
and they're generally and they do a lot of similar tasks to a lot of nurses in A&E, so they can still be trained to do things like bloods and physical health observations. And
so imagine what sort of person you must have to be to go into a ward, because not necessarily A&E. You could be on an elderly ward where you're losing people, where people are dying, because I would assume that when someone really old and is really poorly goes into hospital, a lot of the time they don't come back out. And imagine being on that ward and losing someone, having to go home and deal with cancer and death and shit and just the worst of the worst,
and not for minimum wage, and
for the same amount of money you could get working at McDonald's,
and not having enough money to feed your kids or pay your mortgage or put petrol in your car, and like the stress that some people must be under. Like they're using food banks, aren't they? Some professionals.
What do you mean a professional? And this day and age, and having to use a fucking food bank.
And you think like nursing, not just qualified nurses, but nursing. A lot of people have done it for a long time, so it's all they know. So can you imagine, like, if I said to you tomorrow, right, you can't do your job anymore because that job doesn't exist. So from tomorrow, you're going to have to find another job in a whole new industry. You're going to have to start all over again. Like how that would impact on somebody. So people stay as well for the fear of the unknown, and in the hope that it's going to get better, in the hope that they're going to make a change, be the difference. Am I boring you?
Yeah, no, when you yawn, it's a sign of love. It means that I love you.
If you're a dog.
Is that what you were saying earlier?
If
you yawn each other, it means we love each other.
Oh.
I'm yawning. I am yawning. Although you won't know I've yawned because I'm just going to edit that out. So it's not going to matter. But I think sometimes you do a job.
Because habit. We're creatures of habit, and people intrinsically don't like change.
Yeah. But I also think, like what we were saying earlier, you don't do it for the money. You can't do it for the money because the money's shit. You do it for job satisfaction. And I think sometimes you do it for the status. We were talking about the other day, someone that we know walks around with their NHS lanyard on, like, because they want people to know they work for the NHS because it's a bit of a status thing.
People are proud, aren't they?
People are proud, exactly. And I don't want this to come across wrong, because I'm not saying that somebody who works in McDonald's shouldn't be proud. Anyone who gets themselves up in the morning, goes to work and earns money, whether it's McDonald's, whether it's a bin man, whether it's a CEO of a £1 billion corporation.
If you're meeting your needs.
Absolutely. But it would be very hard to go from having the status of working on a ward and helping people and having that job satisfaction. I can't imagine going from what I do now to putting burgers together in McDonald's. I just don't even know if I could do it.
then
And that's not taking anything away from people that work in
no,
McDonald's. I don't
absolutely
want
not.
because I think
It's put a couple of my mates' kids through bloody university. Do you know what I mean? It's got its merits.
and I think during the pandemic, okay, maybe not McDonald's because they're closed, but I think people that worked in shops were the kind of forgotten heroes.
They were, because like they kept us fed, didn't they?
Dragging themselves in every day.
And it was really frightening in the early days because no one knew, did they? No one knew what this invisible disease was going to do. I mean, it's been around a bit now, and some people are vaccinated, some people aren't. And that's a different debate. But there was this:
Where'd you stand on that?
I'm vaccinated.
What about people that aren't vaccinated? What do you think of them?
I think that's their choice.
You could be a fucking politician, you know. Considering you hate politics.
It is, though, isn't it? It's people's choice, people's preference. It's not for me to tell someone that they should do one thing or another.
So, we're not going to get into politics because you don't want to talk about politics. But we're talking about choice. Now, I know that during the pandemic, so I'm not vaccinated, right? And I know that during the pandemic, there was this whole thing of, oh, you're not vaccinated. There was people who go, you're putting my nan at risk because you're not vaccinated. Now, the way I saw it is, right, I'm not an anti-vaxxer. The whole reason I'm not vaccinated is because I don't have fucking injections. Right? That's why I didn't want to get vaccinated. I'm not an anti-vaxxer. But, I sound like one of the people now, I'm not racist. I've got black friends. I'm not an anti-vaxxer. But I'm glad that I'm not vaccinated. Because I think now it went from 100% to 99%, 98%, 30%, 10%, not effective at all. So not getting vaccinated made no difference to me. But I didn't say to people who were vaccinated, oh, why have you got vaccinated? You're a dick for getting vaccinated. But the amount of people that come to me and said, well, you should be. You're wrong.
People were frightened, though, weren't they? Like I say, there was this invisible disease out there that no one knew really how it was spread, how it could be prevented, and the vaccine was sold as something that was going to protect everybody. And it was on the news every night, wasn't it? Press conferences. Like I don't watch the news, but I sat round the telly every night finding out what the next step was going to be, or what the next thing, or what we needed to do. And I wore my mask in shops, and do you know what I mean? And I suppose in the early days, even decontaminated the shopping when it arrived, just in case the delivery man had sneezed on it wrong way round.
He looks, to be fair, right? We've got a guy that delivers the shopping here. And, like, I hope he fucking washed his hands before he delivers our shopping. Because he looks like he needs a good wash.
But no, and I wasn't the only one. People were like that, weren't they? And like Amazon was spraying boxes with chemicals, and they were saying that don't give them to your dogs to eat because some people give boxes to them. Well, some people's cats and dogs play with boxes, don't they? And so yeah,
Who fucking does that?
but yeah, there was all sorts. So I think all these people that were working in these shops, like the screens all went up, and they got their masks on and they got their gloves on.
Oh, it's fucking ridiculous.
But they were frightened, weren't they? And they weren't furloughed. They had to go to work.
Don't fucking get me started on furlough.
But they weren't furloughed. If you were a hairdresser or if you were non-essential, you sat at home and you were paid. Whether you got enough or not, you were paid.
And now who's paying for that?
Well, we're paying for it.
Were we furloughed?
No.
Is it fair we should fucking pay for it?
Well, perhaps not.
All right, fucking politician.
But do you know what pissed me more off about lockdown than anything else?
Oh, yeah, do you see what?
Everyone had clean windows and short lawns, and you could spot the people that worked because their nets were grimy. Everyone else had clean windows and perfectly groomed gardens and painted walls, and you drove past our house and it's like, oh, they're at work.
Yeah, on your morning walk that you was allowed to go on when you locked down, like that, walking around and go, working, we're at home. Or you go past someone's house, you go, well, they haven't cut their grass, and I fucking know they're at home. I know she's an hairdresser, mucky bitch, and even washed her fucking nets. It was a crazy time, and it was frightening. I know when I got COVID, I fucking thought I was dying.
And the people that were in shops, they weren't furloughed, and they were in shops, and they were tipping up day in, day out, and they weren't sure what they were taking home to their nan or their families. they weren't sure if every time they went out the door they were going to bring something home that was going to kill somebody. They didn't know. So that led to I think a nation of mental health problems, because we were all under threat. And how can you, like, I don't know if you've ever heard of like Maslow's hierarchy of needs, but like if you're under threat at the bottom of the triangle and you're not secure, then how are you ever going to be okay at the top, you know, with all the other stuff? Because the foundations aren't there, are they? And that was across the board.
And now we're dealing with the fallout from that, aren't we?
Yeah, absolutely.
Because there's still that, it's kind of that backlog. And I know that...
I need a wee.
Go for a wee then.
I'm going.
I think, like, all the official stuff's all right, isn't it? But if we're gonna continue to do this, I think people are going to want to see interesting stuff. And I'm not saying what we're doing isn't interesting.
Well, we find it interesting, but other people might not like our musings, might they? Might think, what a boring pair of bastards. It's Norma and...
I don't know, because, like, so I remember, we can get back to the mental health thing in a bit. We'll just have another 10 minutes and then we'll wrap it up, because it's going to be getting late and we can finish off with a bit of mental health stuff. But, like, I'll when I edit, I'll chop out and move things around. But I remember, I know people who did a podcast. I've talked about this on one of my other podcasts, and they were fucking terrible. They were terrible. But like what we were saying earlier, like everyone,
they thought they were good.
They thought they were good, and they probably really enjoyed it, and they did quite a few.
And they probably got a lot out of it personally.
And that brings us back to the whole mental health thing, doesn't it? Because you were talking about this earlier. You've got to do things that you enjoy. You've got to have something for yourself.
You've got to have pleasure and leisure, ain't you? You can. So
is this leisure? Would you say what we're doing now is leisure? Because I'm just thinking, where does the pleasure come? Is that later?
That's later. When you get payment.
You get payment, did you say?
Yeah.
Yeah.
Yeah, we've all got different needs to make us a whole human being. So you can't just meet... If you were just leisure all the time and pleasure and didn't go to work and had no funds, like, that wouldn't make you very well, would it?
No.
And if you were all work and had no pleasure or leisure or recreation, and every single person needs to have a purpose and a meaning. We're all searching for the meaning of life, aren't we? And trying to work out what it's all about. And yeah.
I love you.
But yeah, we all need to have a purpose.
Yeah. No, I agree. I agree, and I think
my purpose is giving you hard time.
Yeah, and I don't necessarily mind that, because you saved my life, so like I have to kind of repay that by giving you a fucking hard time back. And that's how it works, isn't it? That's how a relationship works.
No, it's give and take, isn't it?
Yeah. Later, I'm going to give and you're going to take.
Chocolate.
Yeah, chocolate. So okay then. So we're going to wrap it up. We're going to turn the cameras off. We might leave the cameras rolling. I'm assuming you want to have like another half an hour before we go to bed, because like you've had no time on your iPad tonight. I don't know how you...
That's my leisure.
That's your leisure. So I don't know how you're going to cope. But have you enjoyed doing this?
Enjoyed what? Talking to you?
Because we don't talk. Because we're married, like, so we don't talk much. We don't in the evenings.
Talk all day. I talk for a living though, so sometimes I just want some quiet time.
We've talked loads today. Do we talk that much every weekend?
No, it's been raining though, hasn't it? I've been in.
What, like, so it wasn't raining? What, I go out in the garden and like dig and shit. It's raining today. I could dig in the garden. Going outside on the lead.
I think normally on a Saturday's a bit of a grind day, isn't it?
It's because I didn't get football training this morning. I don't normally get home till lunchtime.
No, so Saturday's normally a day where we're catching up from all the jobs in the week that we haven't done and trying to prepare for the week ahead for the jobs so we don't have to do them. So Saturday's dusting day, isn't it? Washing day, ironing day, shopping,
Because we are fucking busy people.
squaring round the house, picking every bit of shit that the kids leave lying around because they're entitled little pricks and they don't know how to look after themselves in any way, shape, or form.
Mental health professional, just there. Social services watching this are entitled little prick children.
They are entitled.
They leave shit everywhere. Just for anyone that's watching who doesn't know us, we have 2 kids, 12 and 10, girl and boy, and fuck me,
They're like tornadoes.
they are the most entitled, spoiled, fucking lazy. They are, aren't they? Have you already cut that pizza into 4? What?
They'll walk past a bin to put rubbish on the table.
They will.
The eldest will walk past and go, "Is it lunchtime?" I don't know. What time is it? Oh, there's a clock behind you.
Literally next to him.
You've got a watch on. Like, does it look like dinner time?
He come downstairs last weekend, walked into the kitchen, stood next to where the bread bin is, where all the bread products are, and went, "Have we got any bagels?" I just went, like, what? Have a look. Oh, yeah, okay. Like, fucking.
Can you make me one then?
Yeah. When's lunch? He walked in the front door from football training last weekend, walked straight in and went, "Is it lunchtime?" Fucking lunchtime.
No, it's 10 o'clock in the morning. Can I have a snack? Yeah. So what does he get? Half a packet of biscuits. That's not a snack.
So we are busy people.
Yeah. So Saturdays are a steady day, aren't they? Because you're generally out in the morning, but you haven't been today. So we got caught up quite early today. So I suppose we were left with that thing called time.
But not just that. It's not just that we're busy. We've been around, haven't we? We're not new to this. We're not just sat here now making this up. We've already established you're a 23-year veteran mental health nurse. You are a veteran mental health nurse.
I've got a St George's Cross, but I won't say I'm a veteran.
You're 23 year.
I've been in the job a long time.
So there's not much that you haven't come across. But during that time, you've been a mum for 12 years. You've been a wife for 16 years. You've had a husband who's had mental health problems. You've had whatever life you had, where your upbringing, you've had a lot gone on in your childhood. I've been in the army for 6 years. I've been in the prison service for 7 years. I've worked in residential homes with kids for 6 years. I've worked in the homeless sector now for nearly 7 years. So between us, we've got a massive skill set within...
Like Liam Neeson.
Yeah. I've got a particular set of skills within working with fucking difficult people. Because, like...
complex people.
Yeah,
I wouldn't say difficult.
I've got difficult.
Because, like, how would you feel if you went to see someone and they go, "Yours is a difficult case"? Or would you rather someone say to you, "There's a lot to sort out, it's complex, but we can do it"?
Yeah, I think
no one wants to be difficult.
Within your sector and within the young person sector.
Complex.
But within the prison service, there was complex. But some of them were just fucking difficult.
Nasty.
Yeah, nasty.
That's not difficult, that's nasty.
Evil. Some of them were difficult. Some of them were difficult.
Maybe they were difficult for you, but they weren't difficult. They were not very nice people.
Yeah, arseholes. Scumbags. Nonces. So, I guess with that, we've dealt with... I think the one thing we have in common, because I've dealt with people with mental health issues, but everyone has. I think the one thing we have in common is we've both dealt with a lot of conflict resolution.
Crisis management.
Whether it's with the crisis team with mental health crisis, or whether it's with young people who are just in fucking crisis all the time. That's something that we are particularly good at. I would say.
Yeah, I think
And that's
so.
what we've got to offer. I mean, I'm pretty good at health and fitness and shit, and I know like healthy eating, and I know you don't really know about that. You know, like the shit. You know, the shit that you eat. That's not the healthy eating side.
What, my biscuits?
Like biscuits and cakes and Florentines. And do you want lunch? No. Okay, then I'm making lunch. You open the fridge and have a chocolate bar. That's so.
What's
There's
wrong
that.
with that? It's a choice.
It's a choice, and you look amazing. You do look amazing. You are fucking sexy. I'm going to tell you that. So this isn't. I'm not picking on you. I'm not fat shaming. You're not fat. I'm just saying that you don't eat very healthy.
I do.
Dear, what was the last time you had something healthy?
What day is it?
Was it the beef pate, beef paste sandwich? Not even pate, not even posh pate. Beef fucking paste, like it's 1985.
I like beef.
Beef paste sandwich you had for lunch.
I actually had lunch. I didn't.
Well,
have
you didn't have
chocolate.
lunch actually.
I had it at 3 o'clock.
You had it at 3 o'clock
Because that's
you
when I
didn't
was.
because you didn't have lunch.
So I was hungry at 3.
So
I
think-
eat healthy. I eat a varied, balanced diet. You just don't eat any shit.
we haven't even talked about the ducks tonight, have we?
No, my ducks. No, my ducks can wait.
We'll put a link to the ducks. We'll talk about ducks next week. I say we'll talk about it next week. That's if
You get one view.
if this video goes live and I don't get more than 2 views, I'm fucking never doing YouTube again.
Okay.
Until next week.
I would advocate for that. Because it gives me earache.
Do you hate me doing YouTube?
No, I don't hate you doing YouTube. I don't hate you doing anything.
You do. There's that. We're not talking about the. Are we mentioning that?
What, fishing?
So you don't hate me doing anything.
No.
So what's the problem with YouTube?
You get a little bit mardy.
I do when I watch my fucking videos.
You'll make good videos then.
Well, I think this is going to be a good video.
Well, there you go then.
So shall we wrap it up?
Yeah. It's good night for me.
Is that not copyright? Who used to do that?
Hale and Pace.
No, it wasn't Hale and Pace.
Oh no, it wasn't. It was
Good night from me and good night from him. Weren't
it
they
was,
the two Ronnies?
2 runners, yeah.
I feel like I think we're more like Adrian Edmondson and Rick Mail.
Which one am I? Oh.
Okay, so we'll end it there.
I could drop a fridge on you.
I don't really know. I watch a lot of podcasts, but I don't watch them to the end. So I don't know how they end the podcast. Do you just go, bye?
Just fade it out.
Should we sing? What we'll do is we'll start singing, then we'll just fade out the singing.
Maybe you could play a song on the piano.
So we're just going to end it there. I do know how to end it because I end it the same way that I end. TV goals. Fucking hell, I'm not putting that in. So if you have enjoyed this video, give me a like. Give us a like. Like that. What was that program?
Give us a clue.
Give us a clue. You got it. Got it in one. No.
Yeah.
Give us a like. Subscribe to the channel. We'll be back next week, providing people watch it.